Passport Mommy with Michelle Jerson. Motherhood is both amazing and difficult at the same time. The Passport Mommy, Michelle Jerson, is here to share in your journey.
It's amazing. It really is, just watching them grow and see how much change and how much they learn just without the filters around them.
Joining you on your greatest adventure, here's Michelle Jerson, the Passport Mommy.
Welcome to the show. I'm Michelle Jerson, the Passport Mommy. I hope you had a good week. I hope you are staying sane. I say this as I start recording my show, and my daughter just went down for her nap after kicking and screaming that she doesn't want to nap, and my son is now up hysterically crying after just an hour when he normally naps for 3, and he's been up since 5:30 this morning. So I am happy to have with me today my good friend, comic, dad, owner of the New York Beer and Brewery Tour, Marshall Stevenson. Hi, Marshall.
Hi, how you doing? I'm very happy not to have 2 kids, I guess. We've been having a great time all morning. We've been playing trick or treat and ping pong and no fighting. Although I gave in on a couple of demands for cookies, but other than that,
that's why you've had no fighting.
Have you ever heard of the ice cream trick?
No.
You give them ice cream. And then that's the whole trick. It works every time.
Very good. Yeah.
Abracadabra.
We've had birthday cake in the house since Sunday. And so every day my daughter's, I want birthday cake. And I'm so glad that I made it without extra sugar because the amount of cake that she's eating. But that being said, we did have a good morning until just now. But let's talk about that, because you were saying before, why would I force her to nap if she doesn't want to nap? And my whole thing with that is I know how she is when she doesn't nap, and I know that she gets overtired and exhausted. And there are days that I just let it go and I say, okay, let's not nap. Why don't we go for a bike ride, or why don't we do something else? Or I'll try to take her in the car and see if she'll fall asleep there. I just don't want her to get out of the habit of napping, because I feel that she's just 3 years old, and I know that she still needs it because I see how
and
things
that you
are.
need
She doesn't
it,
nap.
and that you need
and
the break,
I need
and
it for my sanity and to do work.
Is the worst.
It is. It's terrible because I have no other time during the day to get anything done, and I feel badly forcing a nap on her when she clearly doesn't want to. But otherwise I can't get my work done.
We have not taken that approach. She either naps or she doesn't nap. Or she naps a little bit, or she naps a lot. Sometimes naps can be anywhere between 11 a.m. and 6 p.m.
Mm-hmm. Okay. Okay.
But maybe you're right. Maybe, my, kid needs to have some more structure during this non-structured quarantine, because basically it's just this big unstructured day.
Does she go to sleep at the same time at night? Every night?
Nope. It always depends, but I will say this: she generally gets almost the same amount of sleep to the minute.
Okay.
If you add up what time she gets to bed, what time she wakes up, what time she naps, and so my wife is like, it's 9:40, she's still awake, but I don't really worry that much about it because she seems to be getting the right amount of sleep and is not showing a lot of signs of being overtired. So if she was showing like a lot of cranky awake time, but I don't know, we just have this problem, like, okay, she skipped her nap today at 6 p.m. She hasn't napped, and then she's fallen asleep in her chair and we can't get her up, and then we get her up and then she gets upset because she wants to sleep.
Right.
Like you can't sleep for 2 hours at 6 p.m.
No, at that point I would just put her to sleep for the night.
Oh, right. Then she'd get up at 11 and be up till 4. What are you kidding? Not with my kid. No way.
Really? She won't sleep for 12 hours?
Oh, no way. She sleeps 9 hours tops.
Oh, wow.
Maybe 10. Never.
Okay.
12 hours? No. No, a few times, that's right. We were in the car at 6 p.m. or 7 p.m. She fell asleep. We're like, we'll just transfer to her bed. 11 p.m. up for 2.5 hours.
Oh, okay.
Bad scenario.
See, I think my personal opinion, and I've said this before, is the more they sleep, the more they will want to sleep. Because I find that when she is on a regular sleep schedule, where the ideal schedule for me is that she's in bed by 8, she sleeps till 7 or 8, and then she goes in for a nap at 1, and she naps for 2 to 3 hours. And when she does that, she tends to sleep 11 hours at night or 12, and then 2 to 3 during the day. But when she goes to bed too late at night, she will wake up earlier in the morning. Then she may not nap, or if she does, then she'll want to nap like the whole day to make up for her night before.
All right. Well, there's that. There are doctors who say that that's the case. We have not found that to be the case. She does not sleep at the long end of the. I don't know what they say that she should be sleeping, but it's hard to force a child to fall asleep when they're going, but Daddy, I'm not tired.
Right.
But Daddy, I'm not tired. You'll sleep now.
I know.
Sleep. Lullaby into night.
That's pretty much how I am at nap time. That's pretty much me at nap time when she doesn't go to sleep.
Close your eyes. Close them.
Do you try music with her? Does she listen to soothing music?
No, I mean, usually, and as I said in the last couple of weeks, I mean, we definitely have been more liberal with video. Mm-hmm. So she seems to go down if she's done a lot of energetic activity in the morning. She seems to fall asleep if we put on Blippi or Frozen. If she's watching Peppa Pig or Daniel Tiger, she's into the show. Mm-hmm. So I have been doing this for a very long time. You put on a show that's like a little too adult for her, and she kind of starts to get bored and can't follow it and falls asleep in a second. But you see, that's elusive, because then she gets older and she starts to understand the show, and then she's into the show and talking about all the characters, and we have to okay, I gotta figure out what other boring show to give her. What we're gonna give her that she thinks it's cool, and then she gets bored quick.
Right.
So that's what we've been doing. But sometimes she just doesn't. And sometimes she'll fall asleep if we take her out in the stroller, and sometimes she'll fall asleep in the car. It is definitely inconsistent. And going to bed is inconsistent, and getting up in the morning is inconsistent. Everybody tells me they get up on a dime, the same time every day, no matter what. This kid's sometime between 5:30 and 8.
Yeah, that's what my daughter has not been consistent on wake ups lately. But I will say, for the most part, it depends on what time she goes to bed at night, but sometimes not. Like I said, the other day, she'll go to bed at 10 and she'll still wake up at 7. And then other times she'll sleep. But like your daughter, she'll be up anywhere between 6 and 10 o'clock in the morning.
There's a lot. I mean, I think there's not a parent out there who has an easy time with bedtime, like a simple time. I'll just say this, they're so interested in controlling certain parts of their lives. It empowers them. So when you say you have to go to sleep now, I mean, they're just conditioned to resist it and then try to resist it. So my feeling is we're in quarantine now. She doesn't have to be anywhere. So, as long as she's not showing a lot of signs of overtiredness, it's kind of so, I mean, certainly after 10, I'll just leave, even if she's not asleep, and she'll understand she has to sit there, and she can't come out, and then she falls asleep eventually. But I guess I'm not that strict about it.
So let me ask you this. How do you get her to just sit there and not come out? Because the one thing that I'm going through right now is no matter what time I put her to bed, she wants one of us to lay there with her until she falls asleep. And then she will wake up inevitably every single night in the middle of the night and come running into my room and want to lay next to me in the bed. There's not one night I've slept without her in my bed in the last month or two.
Well, it's because you accept it. Now, that's a guess. I'm not an expert, but I'll just, I let her win a lot of the time, but then there comes to that issue where she cannot win. So we were finding early on that she was waking up in the middle of the night hungry. And we started to feed her right before she went to sleep, which is a no-no. I understand. Stop getting up in the middle of the night. But we also made it clear, because when she would get up in the middle of the night, it was unacceptable that only babies get up in the middle of the night and she has to sleep through, to the point where she was on the phone with Grandma and she said, Grandma, I was cold last night, but why didn't you wake up Mommy? Well, because big girls don't wake up in the middle of the night. So
that's impressive.
I think that there's a lot of, I know this is probably not what you're supposed to do, but there's a lot of negotiation.
Right.
So it's yes, you're allowed to do this as long as you agree to do this after. And a lot of times it works. Sometimes it doesn't work, but a lot of times it actually works. Okay, you want something else to eat? You want oatmeal, and then you'll go right to sleep? Okay.
Right.
And she's resistant. Then she gets her oatmeal, and then she climbs in bed. And she says,
Right.
I want songs now because we sing.
Mm-hmm. Yeah, exactly.
How many songs? So many songs.
Yeah. No, I hear you. It is. I feel like the entire day is one big negotiation, one thing after another. So we have to take a break in less than a minute, and we're going to actually hear from a dentist who's going to tell us how to deal with dental care during COVID, because I don't know about you, Marshall, but my daughter's appointment is in a couple of weeks, and I don't know what to do with this, whether I should take her or not. But after him, I want to talk to you more.
No, I don't want to take a break. But
I do want to talk to you more because you were mentioning that you just got accepted into a new pre-K program. We just got a survey from our school asking when we feel comfortable sending our kids back with COVID-19, because there are, yes, businesses are slowly starting to open again, but with a ton of stipulations. So I'm just curious your thoughts on this. We're talking with Marshall Stevenson, dad, comic, and owner of the New York Beer and Brewery Tour. Go get your gift certificates now for when that reopens. I'm Michelle Jerson. More coming up in a few.
Motherhood is a journey. Joining you on your greatest adventure, here's Michelle Jerson, the Passport Mommy.
Welcome back to the show. I'm Michelle Jerson, the Passport Mommy. So during the coronavirus, there are medical appointments that we usually go to, and a lot of our providers are doing it via telehealth. But when it comes to our dental needs, it's a little difficult to do that over a computer or a phone sometimes. And there are situations, I know my 3-year-old and my 1-year-old, they're due for their dental appointments, and we had to postpone them for a few months until this all passes. But what if there's a dental emergency? What if your child bangs their teeth and they're bleeding, maybe their tooth turns colors and you're really worried, or you as an adult have a dental emergency? What are we supposed to do during this time? And for that today, I have with me Dr. Alan Gluskin. He is the president of the American Association of Endodontists. Thank you so much, Dr. Gluskin, for joining me today.
Oh, you're more than welcome.
So tell me a little bit about, first of all, you're an endodontist. When should we seek your care?
Most people come to an endodontist when they're interested in saving their teeth, and because of decay or because of trauma or because of an infection, they need an endodontist to be able to treat them in a way that, is specialty care. We take an extra 2 or 3 years of schooling to become specialists, and we are the dentists who save teeth. So we are a specialty called endodontics, and we are used to saving teeth under circumstances where patients have toothaches or they have swelling and infection or traumatic injury.
Right. So when somebody's coming to you, they're at that point where it pretty much is a medical emergency at that point. I know a couple of years ago, after I gave birth to my first child, I had internal resorption on a tooth. I don't know how it got there, but I needed to see an endodontist ASAP. So what do people do who are in that situation now during the crisis?
Well, if you're suffering a toothache, and a toothache that's serious is one that wakes you up out of a sound sleep at night, causes you pain when you're eating with hot or cold, and you have just an unremitting toothache from that experience, or you're swollen and it's coming from a tooth because you've been putting up with something for a number of days or weeks or even longer, then you want a specialist to treat you. You want someone who's used to handling patients in pain. You want someone who's very good at recognizing the kind of pain you're having and administering to you so that you're going to have a comfortable visit. You want someone who's had that extra training and really knows how to handle that kind of emergency. And we have a number where you can look up an endodontist in your locale. If you go to the website findmyeendodontics.com, myendodontist.com. You will be able to put in your zip code, and a number of doctors in your area will be made available to you with other information about what endodontics is all about and how you should go through the procedure.
Got it. Okay. So now if listeners are trying to think, okay, well, I want to maintain my oral health as best as I can during this time because I don't want to have to go into an office, what are some tips that you can give them?
Well, if you can find an endodontist, many of them can be reached by telephone, and you can have a phone conversation or a televisit if they offer that to just discuss your pain and discuss the symptoms you're having and make a determination whether that is something that can wait or whether that is something that needs immediate treatment. Of all endodontists in this country, only 3% are endodontists. But 85% of endodontists have offices that are seeing emergency patients right now. So we are the specialists that are dealing with these kinds of emergencies, and we are the specialists that will and can save your teeth.
Got it. Okay. And then what can we do in the meantime just to maintain good oral practices at home?
Well, everyone should be hopefully brushing their teeth when they wake up in the morning and then before they go to bed at night. So brushing your teeth at least twice a day, 3 if you the possibility is good. And certainly, if you can floss your teeth once a day to get them the plaque disturbed and brushed out of your mouth, if you can use little proxy brushes to help you if you have areas that are hard to get to, good oral hygiene twice a day is really extremely helpful in keeping your mouth clean and healthy.
Perfect. Because I know it is important to save our natural teeth if we can. And so that's where you come in. You do everything possible to try and make that happen. Where can listeners go for more information about emergency dental care and where to find an endodontist near them? I know you mentioned it before. Let's just say it again.
Oh, thank you for asking, because if you go to findmyendodontist.com, you will have an ability to put in your zip code and find a local specialist near you who can administer to your pain by saving your tooth at the same time.
Dr. Alan Gluskin, thank you so much for joining me today. Our teeth are so precious to us. They are important, and that's why it is so important to continue taking care of them, even during the coronavirus pandemic. I appreciate your time. I'm Michelle Gerson, the Passport Mommy.
Passport Mommy with Michelle Gerson.
Don't forget, you can head to the website, passportmommy.com, to listen to this episode as well as any other past episode of the Passport Mommy show. You can also download on any podcast platform. That would be amazing if you could download the podcast, leave a review, tell us what you think, because the more reviews we get, the more people will see this podcast. And you can also follow us on social at Passport Mommy. More coming up in a few.
Motherhood is a journey. Joining you on your greatest adventure, here's Michelle Gerson, the Passport Mommy.
Then I'm here with Marshall Stevenson, good friend, dad, comic, and owner of the New York Beer and Brewery Tour. When things do start to reopen, now would be a good time to get your gift certificates so that you have something fun to do when you do visit the Big Apple, or if you do live there now, I'm sure you cannot wait to get out and to do something fun. But today we are talking about sending our kids back to school and when is the right time. I know my kids' school sent out a survey the other day asking when we feel comfortable for them to reopen, because they follow the public school system here, and they're saying, hey, do we feel comfortable sending our children to daycare either in June, September, I think it was next January, or when there's a vaccine. And Marshall, you were saying that your daughter just got accepted into a pre-K program. Congratulations for next year. So what are your thoughts? Are you going to send her?
New York City is talking about remote learning. Yeah, I generally think that this is my own opinion. I generally think that they've figured out that masks are pretty protective if all parties are wearing them. Mm-hmm. So as long as New York City opens its schools, yeah, we'll go. I mean, I don't think New York City is going to open its schools anytime soon. And in fact, our governor said recently, now we're facing a big deficit, so I don't know what this means vis-a-vis budget cuts and stuff. He said, with all this technology, why do we have all these school buildings? Or, I mean, I don't think they're going to take that radical step to just not have school anymore. But that was definitely, because I think school is so much more than just learning your reading and your writing. And meantime, she's upset she's not going to school now. But we got accepted, and this is unusual. We live in the Bronx.
Mm-hmm.
And a lot of the highest rated schools are in Manhattan and Brooklyn. Okay. So we are probably going to go. We went last year, but it's only partially funded, so it costs us a little bit more. So we applied for all of these just shot in the dark to all these really highly rated schools in Manhattan.
Mm-hmm.
Just in case, because we know we already have a spot where we went this year we were happy with. It would just cost a little money. And sure enough, the one that we were not sure we wanted to go to was the one that accepted us. And that was one in Chinatown. So Chinatown.
All the way on the other side of the...
It's a 45-minute commute with the half an hour subway and 15 minutes of walking.
Wow.
Yeah, so Chinatown. So maybe we'll go to pre-K in Chinatown if we have school next year. I don't know.
Right.
All the kids are Chinese descent, and she'll be a white kid, and that'll be fine. And that's probably what we'll do.
So, you're going to take that long commute where you'll take 45 minutes there and back?
Maybe. I don't know. Maybe. I think so.
That's 45 minutes 4 times a day, right? There, back,
Well,
for you?
Twice. I mean, maybe. I mean, I would probably have to figure out a way to be productive there without having to commute back and forth. Maybe. I don't know. See, I'm not so sure. We would have to, figure it out. I was thinking with the commute, if a kid is going to school by themselves, then a really long commute adds to their commute. But as long as I have to take care of her all day, I'm not so sure that sitting in a commute is any harder than sitting at home for an extra half hour and then leaving 15, and then having a shorter commute. We still have to fill the time. So, I find subway rides in New York City, I've been taking her on the subway since she was born, basically, it's very stimulating. It's a lot easier. I mean, we've been playing since this quarantine. Okay, now we have to put on phones. Now we have to play hide and seek. Now we have to play with the Magnetiles. Now we have to play with the Cheerios. Now we have to play with the beans. Now we have to play with the they just get on the subway for half an hour and have other people wave to her. Not hard.
Right.
I'm just you think about this 45-minute commute but I got to fill that time anyway.
Right.
I'm not so sure it's a big deal for pre-K. He's going to be still 3 years old.
Yeah, because I go through the same debate because there have been some great schools that I've liked, but they're only 20 minutes, 25 minutes away. And we applied, we're in Connecticut, and we applied for the magnet school system in New Haven. And we're number 2 on a waiting list for one of the schools, which prides itself on diversity. And so for that, I mean, that would be great because they're free of charge, but it's about a 25-minute each way commute. And at first, when we first moved here, I didn't think that was a big deal at all. But now when I see how long it takes her to just get ready in the morning and get us out, and so we could get out the door and get to school, I barely get her there on time when we have an 8-minute commute right now.
But wait a minute, that doesn't change the calculation because you would just start the process earlier. It would be the same amount of struggle, but it would be the same amount of struggle. But once she's in the car seat, it's the same amount of time. It doesn't make it harder.
Right. I guess it's just the whole process of starting it earlier, knowing what time she wakes up in the morning, how long it takes to get the clothes on, breakfast.
You don't want to get up even earlier. I guess I get that, but I mean, if the kid has to be there at 8:30 and gets up at 7 anyway, is it better to spend time hanging around the house? I'm getting called here, by the way. Yes, honey. What would you like? Apples. That's what she wants. Okay, we can go back to the show now because I've done my parental responsibility.
Yeah,
the commute is different with a subway than it is with a car too. I mean, you got to actually drive. On the subway,
Yeah, you get
I
to
can
sit there
talk
and
to her.
relax.
I can sit there. I mean, it's not exactly relaxing. Who knows what's going to happen next year? Seriously, we're going to be in the house, like, and they're going to be doing curriculums that have been developed on a computer with, cartoon teachers.
It's so
I don't know.
crazy. So you think September everything's going to be closed in New York City?
Yeah, and I don't necessarily trust the commissioner to do the right thing here based on what they're saying. So, I think that it's going to be a little strange. I think that, it's uncharted waters because if we did get a vaccine, we could go back to normal in almost every area. But if it's going to be one of these things where people, where I am, 27% of the people tested came up positive for antibodies for coronavirus. 27%. But now, seriously, I don't think they're going to have people in group settings for a while.
But now when you say 27% tested positive for antibodies, are those of the people who already had coronavirus?
No, they're starting to test people, trying to test everybody kind of thing.
So those are just random people?
That's a good question. It might be misled because you'd be more inclined to go for an antibody test if you think you already had it. So maybe that statistic means nothing. That's a good point.
Yeah, because I heard
a lot of people in the Bronx had coronavirus, though. That's not up for debate.
So that is actually not a good statistic in my mind, because if the people who are just going for the antibody testing are the ones that have already been diagnosed with coronavirus, and out of those, only a quarter of them have developed antibodies, then that means that 3/4 of them can get the virus again.
No, and let's not go down this route because that's not correct. They think that if you have antibodies, you are immune. They don't know for sure. They said you might not be, but no, that's not what that statistic means. A lot of people in the Bronx have had it. A lot of people were exposed to it. Right. I think that you pointed out a fair question with the 27%, but we know a lot of people have had it. And, density, things spread, and now they're finding out kids can have complications from it they didn't thought they had. So I just think they're chomping at the bit to do more remote learning, which I think has been sort of awful so far. I think that she has spent a lot of time with her parents. I think that her verbal skills are getting better. I don't think the actual interaction with the teachers and the homework they give has been a big part of her development, but she's young. I mean, maybe fourth grade is different.
Yeah. I mean, I wonder that too, because I'm barely doing any formal learning with her at all. And today we traced her name, but I always feel, I should be doing more. I should be doing more lesson plans. But I mean, basically I take her outside every day. We go for walks. We play in the backyard. She plays a lot with her kinetic sand. She plays with her magnet tiles, and she just interacts with her brother. And we dance and we just do things, but we haven't actually done formal lessons of any kind.
I wouldn't worry about that. I would think that, I'm probably the wrong person to ask, but the way we've just thought about it, and, my wife does more formal lessons with her because she's a teacher. Right. But play, talking, discovery, creating new things, not having a lot of rules on a game, let them make up their own rules. That's all learning stuff.
Yeah.
I just wish there were more places she could go and people to meet and things to see. So you have to create all that discovery in your apartment. But they're like, make paint out of ketchup. We're like, my wife's a painter. We use acrylic.
Right. Why would you have to make paint out of ketchup? Why?
Because they're coming. First of all, it wasn't ketchup. This is, I'm just trying to express how I feel about these homework assignments. But they're like, draw a butterfly and cut it out. And okay, now I don't have a homework. I don't want homework.
Right. I was going to say, I don't think I would be doing well right now if we had homework and things to do.
We're playing a lot of knuck hockey, and that's the way it's going to stay.
Yeah. No, there's no way. And especially when you have two kids at home and one who's like my son's age, who's one, it's just hard to balance both of them throughout the day. And it's really hard to devote one-on-one time with one of them when they're on the same schedule.
So can't you relax a little more and not enforce rules and just sort of let the day happen the way it happens and not worry about what they're doing?
I usually do, except for nap time. And even some days I do just let nap time go and I just give up and I say, okay, it's a beautiful day. Let's go for a bike ride instead. And I'll take her for a bike ride. And that's what she said today. She says, I don't want my crib. I don't want so here's another thing. So she normally sleeps in a bed, but lately she has decided that she wants to sleep in her bassinet that we pulled out of the basement that I was about to sell. She decided she wanted to go to sleep in that. And I said, fine, whatever is going to make you take your nap. I don't care. But today she says, no crib, no bassinet, no bed, no quiet time. I want to go for a bike ride. And normally I would have taken her for a bike ride probably, but you know what? I had a radio show to do. So that's where I start getting antsy and I try to enforce the nap.
And that's the challenge here because we're all working and we have children at home that we had made arrangements for them to be taken care of by somebody else during those hours. And well, maybe the solution for you is this. Just don't feel guilty. We're all doing fine. It's okay if they're watching a lot more video than you would normally watch because there's so much cut off. Everybody's in the same boat. I think having fun with them and letting them, because you're their playmates. I mean, your young one he's really lucky to have a big sister to play with, huh?
Yes. And the two of them together, they have fun with each other and it's great. And I mean, I really find that they're learning from each other and they're amusing each other. And I really feel that it's been very beneficial to the both of them to have had this time together at home together, as opposed to her being at school all day and him being here with me. I think that has helped the both of them grow tremendously.
Does that give you a little bit of time to at least look at Facebook if they're playing by themselves and you can be sitting on the couch? No, not at all. They involve you. Why not?
Yeah, all the time. Yeah, it's very, I always need to be involved. I try not to.
So you can't just be like, okay, 2-3-year-olds, you're the babysitter. Here are the emergency numbers. I'm going in the basement. Something happens. You give me a call. You can't do that. You can't just.
Yeah, no, I wish. Like I'll say to her, hey, can you go make sure he's okay, that he's not falling down the stairs? No. But sometimes she's really good and sometimes she takes really good care of her brother and it's really sweet to see and she'll share. And then other times she's just the complete opposite. So, you never know the situation in the day, but I still do have to be very heavily involved.
Imagine
anyway,
some parents aren't.
I know.
Some parents aren't at all.
I don't know how.
Their kids don't turn out good. That's why they have to listen to this show and get the best advice.
From us, I don't know. Marshall, thank you so much for joining me again today. And don't forget, get your gift certificates now to the New York Beer and Brewery Tour. Is there a specific date or it's open-ended to whenever they want to use it?
Yeah, so they don't expire and we're offering 15% off. And it'd be a nice thing to help us out because we still do have ongoing expenses and we'd like to be dormant and then reopen. So we will reopen as soon as we can, and gift certificates never expire, and we could all we'll make sure that it will be a great time when you do come.
Perfect. Marshall Stevenson, thank you so much. I'm Michelle Jerson, the Passport Mommy. More coming up.
Motherhood is a journey. Joining you on your greatest adventure, here's Michelle Jerson, the Passport Mommy.
So one thing that I feel families worry about, especially during this time when a lot of people might be losing their jobs, is where they're going to get their health coverage. And especially with the worries of the pandemic and just in general, people's health, it's really important to still be able to find the doctors that you need and to go to get care when you need it. So today I have with me Calder Lynch. She is the Deputy Administrator and Director for the Center for Medicaid and CHIP Services within the Centers for Medicare and Medicaid Services. Hi, Calder. Thanks for joining me.
Hi, good morning, Michelle.
Good morning. So tell me a little bit about Medicaid and CHIP, because I feel like some people who maybe this is their first time that they've ever been unemployed, they're not really sure where to start with these programs and what they offer.
Absolutely. Medicaid and CHIP work hand in hand to provide low or no cost health coverage to over 35 million children across the country, children and teens. It's an income-based program. It's administered at the state level, but all across the country, low-income families can find health coverage through Medicaid and CHIP for their children, teens, and adolescents.
Great. And so who is eligible for these programs?
Sure. It's children up to age 19. The actual income standards will vary a little bit from state to state, but generally for a family of 4, children whose parents earn up to about $50,000 a year or sometimes more may qualify for Medicaid or CHIP.
That's terrific. So how does somebody go about applying?
Sure. The application process is done at the state level, but if folks aren't sure how to get in touch with someone or what that process looks like, they can visit insurekidsnow.gov or call us at 1-877-KIDS-NOW, and we can provide additional information about the program in your state and get you connected to the application process, which can be done online, over the phone, or through a paper application.
Great. And so what are some types of medical services that are covered by Medicaid and CHIP?
Medicaid and CHIP cover comprehensive health services, including primary care, pediatrician visits, doctor and hospital visits, prescription drugs, immunizations, often covers dental services, eye exams, mental health services. It's truly very comprehensive.
Yeah, it really is an amazing program for yourself. Even if you don't have children, obviously healthcare is very important for everyone. And to have a service like this when you do need it the most is just so, so important. But I feel like a lot of people don't really realize the importance of having health coverage. So why is it so important, especially for children and teens?
It's incredibly important. I mean, Medicaid and CHIP provide health coverage to ensure that our infants are able to get the vaccinations they need early in life, that children can get regular well-child visits to make sure that they're developing appropriately and that they're staying healthy. For teens and adolescents, it can be important, to be able to do sports physicals, to keep up with those immunization schedules. It provides needed mental health and behavioral health services, which is so important, especially in times like this. And it's really important that everyone have a routine source of health care.
Right. I agree. And so is there an enrollment period for these programs, a specific month that somebody can enroll?
There's not. That's the great thing. You can enroll your family into Medicaid or CHIP any time of the year.
That's terrific. And again, tell everybody what website they can go to, where they can find more information. And then once they do get accepted for Medicaid or CHIP, where can they go just to find which doctors would be in network for them?
Absolutely. As I said, folks can apply online, over the phone, by mail, or in person with your state Medicaid agency. And if you're not sure how to get in touch with them, you can visit insurekidsnow.gov or call 1-877-KIDS-NOW for additional information. And once you're enrolled, you'll receive welcome information from your state or health plan with all of the information available to find a participating healthcare provider.
Great. Now I have to ask, how is the service right now as far as for somebody getting through if they do call that phone number? Are there enough staff working right now where they won't have a hard time reaching somebody to speak to? Because I know some other programs like the state unemployment offices and such, it's basically impossible to reach anybody.
No, absolutely. These lines are manned and they're ready to take questions.
Terrific. Calder Lynch, thank you so much. Deputy Administrator and Director for the Center for Medicaid and CHIP Services within the Centers for Medicare and Medicaid Services. If you need the health insurance, please go online now. Check out the websites. Give that phone number a call. It is so important for you and for your children just to stay healthy, preventative care, and also when you do need it the most. I'm Michelle Jerson, the Passport Mommy.